Okay, and we are here today with another very special guest, Councillor Michael Ford for the City of Toronto. He's actually the councillor in my area for our main clinic for PinPoint Health. So, Councillor, thank you so much for joining us today and giving us sort of a politician's perspective on COVID-19. I think it's really important that we're hearing a lot from our national and provincial governments, but really this is something that is the granularity of the situation goes all the way down to the municipal level. This isn't something, it goes down to the individual households, right? So I think it's great to hear from someone like yourself, a councillor. I believe you're also a board member with Toronto Police, is that right?
Yes, so to start off, good morning, Dr. Nalli, and to everyone out there. Thanks for tuning in, and Doctor, thank you very much for having me here.
Just call me Lou.
So I sit on as the city councillor for North Etobicoke here in the city of Toronto, as well as I have a few of my council appointments, being which I sit on the Toronto Police Services Board and the Economic and Community Development Committee for the city.
Okay, well, that one's very relevant. One of the interesting things, and maybe we can start there, I believe Mayor Tory over, it would have been late last week, was sort of giving us some projections on the deficit that's sort of might be the reality of the situation when this goes. And I know that there were varying levels, right? Whether this goes for 6 months or 9 months or 12 months, of course, that's going to change. But what's your take on that in terms of from an economic perspective at the city level?
Well, look, no doubt that life has changed incredibly in the last couple months. As soon as we started to take serious, but I would have to say appropriate measures to try to shut the city down. And it wasn't necessarily a shutdown per se, but it was quite close to it, where we had to close restaurants, businesses, ask people to stay home. That took a huge burden on the city of Toronto. And of course, on the finances of the city of Toronto. Here in the city, we have an approximate $11 billion budget. And just in the last couple months since we've taken these precautions, of course, as you can see, user fees across the city have dropped. Of course, the TTC, no one's riding the TTC now. I think ridership is down 90%. So definitely there's a huge hit to revenue there. So what myself, my colleagues on council, the mayor, the city manager, our CFO, just to name a couple people, have been looking at the stark reality of this is going to be approximately $65 million a week that we're going to have to look at stretching out to 1.5 billion, we're hearing, in the long run as we go through this. So no doubt after all this, we're going to have quite the mess to deal with and to clean up.
And are there, I mean, this may be preemptive, right? But are there any thoughts given to how those, because I mean, that's an incredible sum of money. That is not negligible. That's not something that you can just sort of look past. And I think not just Toronto, but across our country, I think, and our province, we're doing a great job giving back to people and really stimulating the economy. But that is going to come to a cost to, I guess, eventually taxpayers, right? It has to, because money's not something that just gets created out of thin air. So are there any thoughts already given from the city on what types of things might need to be put into place in order to start to retrieve some of those funds in the long run?
Of course. Well, I think one of the first things we're going to need help with and it's not the first time you've heard a politician in the city of Toronto say this, but is other levels of government. Yeah. We're going to have to work with our provincial colleagues and our federal colleagues, because this is a huge situation. Given any budget year, City of Toronto goes into the budget year, maybe with a $100 million gap, $200 million gap, which we have to try and find efficiencies on, try to find savings on. Going into a budget year with 1.5 billion is astronomical. But I think it is our job, kind of going slightly off topic here, but very relevant for your viewers, Doctor, is about supporting, people who live in our city, people who are on fixed incomes, and we have to be there to help them, because right now they aren't getting a paycheck. A lot of people who are even calling my office, I hear it firsthand, they're really having trouble making ends meet right now. They're going into they're approaching May 1st, which is the second month of rent that will be due, and these are all economic situations that we're all trying to grapple with. So I know the mayor has done a phenomenal job to date on trying to put stuff in order. One of the things the city announced is a property tax deferral. Yeah. Now, mind you, I know that doesn't answer the big questions or it doesn't do enough when it comes to helping people. It's, the city's ability, we're somewhat limited to what resources we can put in place. But working with our provincial colleagues who are coming up with a number of things to help people, and then the federal government, of course, with their stimulus packages they're putting out, hopefully working together, having a collective effort on that. But no doubt in the coming months, and I'd even say longer, we as a city council will have a lot of work to do on rolling up our sleeves and getting the city's finances back on track and getting life back to normal.
Yeah, and I think, Councillor, that's a really important or a really important point for people to appreciate, because I think a lot of the times the average person doesn't realize why governments have to tighten budgets at times, right? They don't realize, and they just think like that it is something, we should be spending money all the time and but they don't realize there needs to be a balance, right? And anybody that understands a balance sheet knows that, when things are out of balance, you need to find a way to bring things back into balance. So I think I really appreciate the honesty there for the listeners and the viewers on the reality. There will need to be things done in the future for sure that will tighten it. I think it's great that all levels of government thus far have stepped up in so many different ways to provide whatever support. And I know you brought up the point there about the property tax deferral, and you said that it's not enough, but it's something, right? And you guys implemented it very quickly. It wasn't something that took months and months, and that couple $100 a month or so for individuals, it can be the difference between paying something else, just like something a necessity like food, right? So I think that's important.
Yeah, no doubt, Doctor. And even more so to that, I think, just actually carrying on where you kind of left off there on budget. I think that's why, whether it's been a year ago, or I think people have always heard the dialogue on balancing budgets. And why they hear that so much is because when disasters, and I'm going to put this as a disaster, like this hits, the financial impact, it could be crippling and devastating.
Yeah.
And that's why it's so important that we always have a watchful eye on finances. That that can never stop, because realities like this hit, and we have to be able to recover from it. So I appreciate that the comment you made, Doctor, and why it is so important. And that's why people hear about balancing budgets and spending money effectively, because at the end of the day, it's not my money. I'm a servant of the public. I'm a representative. I have a say on how money is spent. But it's your money at the end of the day. It's your listening. And that's why we have to be so careful.
Yeah, I'm a big fan of Ray Dalio, who's the principal at Bridgewater and Associates, and
Yep.
you know, one of the things that he'll often talk about is, and this sort of relates to it relates to anything where it comes to finances, whether it's the city financing or individual financing. You know, I think in the last, you know, we haven't had a time in like this since probably the Great Depression, where there's been this type of unemployment, this type of issue going on. Generations prior to us, you and I are probably around the same age. Generations prior to us had a different outlook, right? It was all about saving. It was all about making sure that you need to be prepared for worst case disasters, because you never know when a disaster can happen. And I actually, from the level that I work at, and we have mental health professionals that work with us. One of the things that I've said to people, as well as I've heard some people say that, you know, after the first week of this crisis, they were already saying, you know, I'm going to lose my house next week, or I'm going to do this. And I completely feel for them. But one thing that really brings into question for me is that means you weren't prepared for a disaster, because if already after 1 week, you are in a position that it's become that bad, then that's a more fundamental issue. And I think that fundamental issue, that we're spoiled because, again, in such a long period of time we haven't dealt with this, that spoiled level on a personal level carries over into government. And that's why there's always this thought that, you know, it doesn't matter, government should just spend money, they should just spend money. And you bring up a great point there, where it goes back to, well, no, we got to be, finances are important, because at a certain point, we don't know. We didn't know that this was going to happen. We don't know the next thing that could potentially happen. So I think that's a really great point on your behalf, that finances are something that always need to be considered, even outside of a crisis, because it essentially prepares you for these times.
Exactly. And just to, you know, seal off that train of thought, because look, as a politician, I could talk for hours on this topic. But, you know, it's also a politically hot topic, which right now we want to kind of try and approach with sensitivity, of course, and not getting ripping into politics of it. But look, Doctor, I think the point has to be made. And to sum it up, in my opinion, is that how we take care of our finances in, you know, the times that are pretty steady, gives us the ability to help during these times, right? To do those bailout packages, to defer property taxes, because we have reserve accounts in the city of Toronto, which around budget time, and to avoid the politics here, and I'm saying this respectfully, but, you know, some councillors do want to use those accounts to fund whatever those priorities may be for them. And that could be good, could be whenever that may be. But at the end of the day, those accounts are important when we have to take this cushion, which we're doing right now.
Yeah, and I think there's a paradigm shift that's going to happen that's similar to what happened after the Great Depression, and that generation of people that grew up always knowing, like, hey, something can happen, so let's be prepared. And that's a bigger topic than you and I can get across during this, but I think it's an important topic to at the very least consider. What are you hearing from your colleagues at the provincial and federal level? Because obviously, being a city councillor, you've got lines of communication open with them. What are some things that you think the public should know about?
Yeah, no doubt. Well, I think the leadership of all three levels of government are on the exact same page on the same day. I think they have done an extremely good job of doing that. I think Mayor Tory, representing the city of Toronto, has done a phenomenal job, I have to say. And I commend his leadership during these difficult times. I speak to him once or twice a week. And I really think, you know, he's on the right track. He's listening to our communities. Provincially, you know, I know that they are really focused, and not to speak for them by any means, but what I'm hearing and what I've been seeing is that they are very focused on the broader picture of this fight against COVID, supporting our hospitals, our long-term care homes, which is right now just having a devastating impact. I have I have many long-term care homes in my ward of the city, but
That's
I have
just
one
around
that
just around the hospital. All
absolutely,
aware
and
of it. Yeah, it's part of our community of people we serve.
yeah, so we're keeping an eye on that. But we can get to that maybe a little later in our talk. And then of course our federal colleague. So I know in North Etobicoke, because I do want to stick to my
Yeah.
community in what we're doing. So I'm in conversations with Premier Ford, of course, because he's also our local MPP.
Yeah.
So I'm in conversations with him, on a daily basis. And of course, Dr. Kirsty Duncan, who's our member of federal parliament, who's also been doing a great job. We are always on the phone talking to one another. So from a community standpoint, we are constantly collaborating about what they're hearing, what I'm hearing, and it's just we have to put the wealth of knowledge out there so we know what everyone's doing, and we need to know what's available for people. So that's happening. But on a higher level, which I can speak to only so much, but I know that all three levels of government have been collaborating daily. I know our respective medical officers of health have been in conversations. I know Dr. Eileen Davila, who's doing, saying everyone's doing a great job, but they really are given the times and what we're facing. Dr. Eileen Davila, who has done a great job from the city's side of it, and they continue to have those conversations. What I am hearing, I think what we will see later today, I don't know if it's come out yet, but the new projections and the numbers that the city's facing, as well as the province, what the word on the street is that we're kind of hitting that peak, which is important. I think the mayor said that today. We're approaching, if not, we're in that peak. We won't know till after, but we think we are. And this is the time more than ever that we have to remain vigilant of social distancing, staying home, because we want to get those numbers down.
Yeah. And I think,
So,
yeah, I mean, I obviously, with my role in healthcare, keep a close eye on these types of things. And we're definitely doing a good job plateauing. Like you said,
yes.
we won't know when we're on the other side till we're on the other side, because it's all
Correct.
about hindsight at that point. But I think we're doing a good job. And I think Canada in general, I mean, some places are doing better than others, but I think overall you could say that we're doing as good as we possibly can.
I've spoken to a couple doctors in the field, works at Humber Hospital and whatnot, and they're pretty, look, not to make light of anything, because there's nothing to make light of.
No.
It's a very serious situation, and we have to make sure our hospitals have the resources and everything we have. But just in talking with some of our frontline healthcare workers, I asked them how are they handling it, how are they coping, and in their opinion, and there's many opinions out there, so this doesn't necessarily ring true for everyone.
Right.
But they feel that we got ahead of it slightly.
Yeah.
I think that's the feeling, which is good.
Yeah.
But we just have to keep going on it.
Yeah, a lot of my colleagues are frontline healthcare workers at Etobicoke General specifically, which is in, and same thing. I think the overall message is that, things, thankfully, you're right, it's not to make light of it, but thankfully things seem to be under control. I think that's important because I think that gives potentially a false sense of security to people, where when they start hearing these positive things, they think, well, okay, well, that's great, we could just go back to normal. But that's, and I think it's important for both of us, and especially you as city councillor, to reiterate that is not the case. The very reason we're in such a good state is because we're doing the right things, and what we need to do is continue doing the right things. And I think that's an important message.
No doubt. I think now is the time that we have to really stick to the advice of everything that our respective medical officers of health are are sharing with the public. Because look, the more we do it, and I know it's tough. I know it's tough.
Yeah.
I'm an individual who loves to get out on my weekends and go for road trips and go explore
Yeah.
and cross the border and do stuff like that. So believe me, I know it's hard,
Yeah.
but it's important that we all do our part, because once we get through this, the quicker, the more we do now, the quicker we get through it, and then, the quicker, we get back to some, semblance of normal. We don't know exactly what that is yet, but definitely better than where we are now.
Yeah. And I think it's great to hear, going back to your point about the communication that you have with the province and the federal level. It's great that everyone is communicating, because I think in a time like this, that's absolutely key. So it's refreshing to hear how much communication is actually happening. Obviously, everyone would assume that it happens, but to the extent that it's happening is I think a really important thing. And it just makes for Go ahead. Sorry, Councillor.
No, no, all I would say is yes, no, absolutely. We see it across the province, or seeing it across the country. I think most of us are on social media. We see what other representatives are doing. They're doing town halls, virtual town halls, with other members of parliament. Doesn't matter who their respective party line is, or political beliefs or anything. Look, we're all here to, we all have the common goal of fighting this, getting through this, again, our society back on track, socially, economically. It's just critical that we do.
Yeah, and I think the idea that you brought up there of the depending on political stripe, I think another great thing about Canada is that I think most politicians have been able to put away their partisan beliefs, right, and really work as a team. Whereas when we look south of the border, we see a little bit more of a divide obviously going on. And I think that in the long run, that's just not the objective here. Is health and safety. And I think that that is not a partisan issue. I think everybody wants that. And I really, the leaders of the province, of the provinces of the country, have all stepped up in a way that I think is most people would be happy with. I don't think there's many people that are going to say that they're not happy with what our leaders have done, and I think that's great. With your role at the Toronto Police Services from a policing service, anything there that you think is important for us to know?
Well, look, I want to take I'm going to take this opportunity. I actually want to do it at the start of the podcast, but we jumped in, which is great. But I want to take the opportunity to thank all of our front lines, whether it is our doctors, our nurses, people who are cleaning our hospitals, our long-term care workers, PSWs, and then of course bringing to my thought is of course our police officers, our paramedics, our firefighters. The list can go on, because there is a lot of people out there who are making a huge difference, doing marvelous work. But of course, I, in my role as a member of the Toronto Police Services Board, I have a weekly call with the chief and the board. And the first thing I tell him on that call is, Chief, you guys are doing a great job. Thank the frontline men and women for what they're doing. But from a policing perspective, it's been kind of very out in the open. Of course, the police still do their daily job responding to 911 calls, and they continue to do that. But of course, with the emphasis on enforcing the social distancing, bylaws right now that the city has enacted, that is a big part of it. The city has put together kind of like a SWAT team per se on that, with I know Toronto police officers, bylaw enforcement officers, Toronto parking officers, special constables, are all tasked with this right now. So I know Toronto police are doing great work. I know not to speak for the chief, because I don't in any way, but I know the chief has been doing a great job out across all divisions. He's traveling the city, he's talking to his front lines, and making sure that they have the resources they need. That is being, a conversation at the boardroom table, is that do our officers have the supports they need, the appropriate PPEs, and I know we're very focused on that.
With going back to the infringements that we were talking about with social distancing, and the city sort of cracking down on that, are we seeing numbers going up, or are we seeing numbers going down? Are people following the rules better, or are we sort of stagnated?
Doctor, I don't have the specific numbers. I haven't heard. I do know what I can say to that point is, look, we don't want to be out ticketing people. That is not what we are trying to do here. But we do have to have a level of enforcement when people aren't listening. And I wouldn't say there's a ton of people doing that. I think definitely in the minority, definitely in the low minority. But there are people who are not getting the message. And I think the mayor has been very upfront about this and direct with the public, that this is about education. It's about making sure people know that it is not okay to be going out, hanging out with friends, people you don't live with, in big groups. That's not okay right now. And after about, I would say, a week, I think our collective tone as a city changed to now it's enforcement. So I know they have tickets in the hundreds. I think a gentleman was arrested, unfortunately, in Scarborough for assaulting a bylaw officer. I absolutely think that is disgusting. And yeah, my blood boiled when I saw that.
Well,
yeah, we have to remember that these individuals are out, putting their own health at risk potentially, by making sure the safety of all Torontonians is there. So that was not good. But I think in general, I think people get the message.
Yeah, and I think it's an interesting thing, and I've sort of said this on my radio program on Global News, and maybe I'm a little bit harsh, but I think the reality is with rules that 99% of, maybe more, 99.5% of people don't need an enforcement to tell them to stay home. They've been told by public health people that, hey, this is dangerous. They take it. There's that very small minority, and the sad part is that minority, with or without enforcement, are likely the ones that are going to create the problem regardless. So
but that's and Dr. Nalli, you're absolutely correct. That's what the mayor said, and it rang true to me when the mayor said, he said, look, these are the same individuals that will give the police the middle finger, but parking enforcement people the middle finger, and do what they want to do. Well, the reality is they can't do what they want to do right now, and nor should it be condoned by society. It's not condoned by society right now.
No.
And if you want to be, I'll be quite honest with you, a first-class idiot doing that, I am no pride. How I can describe these people could be quite bold. But I won't go there. But look,
you're preaching to the choir on that. I agree with you.
Yeah, it. As I said, it boils my blood when I do that. But
yeah, it's
look,
just again, it's
doing it.
Yeah, it's the rules that are designed for the 1% that won't listen to them anyways, right? So a lot of, and that's sort of the way it goes with many rules, right? Not just this, but I agree with you. I think reiterating what you said there. For our frontline healthcare workers, of course, but even our public service members like the Toronto Police, paramedics, they're out there doing a very, very important job and literally putting their lives at risk for them, their families, their loved ones. And to hear that people are disrespecting them because they have a job to do. I mean, again, I don't know anybody that would condone that. I don't think anybody that's reasonable does. And it just, we, again, thank all of those people for doing the things that they're doing. The frontline healthcare workers and the public service members. Thank you for for doing that. And when you speak to the chief of police, please, he doesn't know who I am, but thank him. When a constituent of yours wants to just simply say thank you to the men and women that are out there doing that they need to do. Councillor, is there anything else that you think is important for viewers and listeners to hear right now before we wrap it up? I think it's been a great discussion.
Yeah, well, Doctor, what I would say is I want to thank everyone, all your listeners, everyone out there, my community, for really, during these very difficult times, staying home, focusing on social distancing. It is making a difference.
Yeah.
We are seeing that today. We're going to see it in these projections. Team Toronto, Team Ontario, and Team Canada are doing a really good job here. Let's keep doing it. I know it's tough, but let's listen to our health professionals. They know what they're doing. They have our utmost confidence. I think they have society's utmost confidence. And I think they've been proving that with how they've dealt with this so far. So please keep focusing on that. To the people out there who need a helping hand, who are going through a tough time right now, call my office, 416-397-9255, 416-397-9255, or counselor_M4@toronto.ca. We're doing everything we can. I have my whole team in my office working to connect people with the help they need, whether it's groceries, whatnot, provincial supports, federal supports. And of course that's changing and they're adding more stuff to it. But please do not hesitate to reach out to us, or any questions you have. We are here to help.
Yeah, and I could personally vouch for that, Councillor. You and I got in contact because I had an issue with one of that has now been resolved, but I contacted your office. You guys immediately got back to me to help me with that issue. And then, even with this, as soon as I reached out to your team about having you on the podcast, it was an instantaneous response. And that's the legitimate truth for the listeners. Yep. And I think that really speaks highly of your character, and how much you care for your constituents. And I think all we can simply say is, again, thank you for your service. We hear about everybody else, but the politicians are doing a lot right now. I see a lot, even someone like your uncle out there, doing all the things that he's doing, putting out in the public. So thank you, Councillor Michael Ford, for being here with us today. Thank you for your service during this time. I appreciate it, and I'm sure everybody else that is listening also appreciates it.
Well, thank you. Thank you. All right, Doctor.
Okay.
All the best.